You know, Americans like to think of themselves as world leaders. They also like to think of themselves as having some of the freest, most flexible labor markets in the world. So it's possible those two things are going to come into conflict today as America is leading in occupational licensing, perhaps, something that does not exactly lead itself to the freest and most flexible labor markets. And to get a sense of whether that's true or not, we've got a great panel here today to talk about occupational licensing across countries. I think the goal here is to establish exactly where we stand around the world, both looking at Canada, the UK and Europe, where the extent of occupational licensing is, and to get a sense of what some of the differences might be and how they may be affected by different institutional environments in different countries. And then lastly, to get a sense of different policy options that might be on the table for addressing this to the extent it's viewed to be a problem. So I think we're going to go just across from my right to left, your left to right. We'll start with Maria Koumenta.
Thank you, Mark, and thank you, Maurice, for the introduction. And I do have some slides to sort of guide me through. So I'm here to discuss, my work, my research has been on understanding occupational regulation in the EU and the United Kingdom. So what I'm going to talk about a lot draws on the work we've done so far. When I started working in this field about 10 years ago, the literature was nowhere as advanced as the literature, the economics and legal literature is in the US. So we were starting from a very, very low base, and we have been following we have been standing on the shoulders of giants like Morix and his various collaborators, some of which are in the room. I'm going to start with the European Union, and this, what I'm going to discuss draws on the work that me and Mario Pagliaro, who unfortunately couldn't be here, have done for the European Commission. And I have to say that the European Commission, it's a shame Andrea Martins, the chief economist there, is not here to join us today, but the European Commission has shown a very keen interest the last sort of 10 years, I suppose, on an occupational regulation and understanding this labour market institution. The way when we start looking at occupational regulation in the EU, we started by understanding the political economy of this of the regimes, what we found was a lot of similarities, but a high degree of diversity. So we have licensing, the way licensing is understood and defined in the US context, so state-enforced regulation. But we also have state-sanctioned self-regulation associated with certification and accreditation. And this is led by professional bodies, but it is usually endorsed by the state. We have a high heterogeneity, I suppose the same way you have here when you compare different states with regards to what occupations are regulated. So it's not uncommon to find occupations regulated in Romania and Bulgaria, but not regulated in Italy or the UK. But also there's quite a lot of heterogeneity in terms of what types of regulation arrangements we find in occupations. So a lot of the research on occupational regulation in this country, in the US, talks about entry into occupations, licensing, etc. But what we have quite widespread in the EU is a lot of regulations that have to do with conduct once regulations become licensed. At the EU level, it's very rare to find licensing, so licensing that sort of cuts across different member states. But there are some initiatives to harmonize training standards. For example, we have now some common standards in accountancy. And also, there are some initiatives to create professional representation at the EU level. So these are professional associations that come together and they try to lobby, usually the European Commission, but also separate member states. Our data sources are not as advanced as the ones you have here. There are two different types of data that we have been drawing on. The European Union, the European Commission has the database of regulated occupations. So there one can look at the what types of occupations are regulated and how occupations vary in terms of the regulatory arrangements imposed on them, depending on the member state. It's better maintained these days than it was when it was first established. But nevertheless, a lot of interesting information. But what from a database point of view, the biggest sort of step and achievement we've had so far was convincing the European Commission to actually introduce a survey of regulated occupations. And this was inspired by the work by Morris and Alan here in the US. And here we are surveying individuals, so which enables us to produce better estimates of who is regulated and who is not, as opposed to the occupation-based approach. Morris discussed this earlier. So about 20% of the EU workforce are subject to licensing, and about 21% subject to certification. Not very different to the proportions we see here in the US. So a quite widespread labor market institution, but a high degree of variation depending on what country we're looking at. So column 1 here ranks member states with regards to the proportion of licensed workers they have, and you can see Germany is at the top, followed by Croatia and Ireland. The UK, that I represent, I suppose, research-wise, is kind of in the middle. And then some countries that were commonly thought to have very strict regulatory arrangements, like Spain, Portugal, sort of the Mediterranean economies. What we find is actually when you look at the proportion of licensed workers, there are not as many compared to some other labor markets, such as Germany. I mean, the Germans were not very happy with this. And when they saw it, the Germans are very pro-licensing, by the way, and their professional associations are extremely well connected all the way up to the state, big decision makers. And then what is interesting in this table is when you look at the third column, there is very little correlation, and I think this is why the Germans were surprised. There is very little correlation between column 1 and 2 in terms of how many occupations are actually subject to licensing. So you might have Germany with that only licenses 67 occupations, but employment within these occupations tends to be disproportionately high. So that gives you an idea. Then we moved on to examine in a sort of traditional fashion in terms of the research on occupational regulation. We looked at wage effects and employment effects. The story is that there is considerable heterogeneity by occupation. You can go as high as 19% when you look at crafts. There's no effect for managers, and 6% for the sort of more traditional professions. And of course, there is an employment effect, as we would predict, classical economics would predict. We, at the EU aggregate level, we estimate this to be about 700,000 jobs, less jobs, but again, depending on the occupation, it could be 9% and 3%, depends on the occupation. The other work, and this study is finished and it's available online. And the other work we have been doing recently, and Morris is also involved, and Dawood here in the audience. So the European Commission was interested in understanding the impact on the quality of services. And we are now finishing some work on this. So we looked at 6 different occupations in 7 different member states, and you can see the list there. And I can't really talk about the results just yet, but the idea here is to none of these occupations. We're not looking at the binary licensing 0-1. You know, none of these occupations was deregulated. So we're looking at relaxations in stringency or variation in stringency. For example, taxi drivers in the UK and Ireland, where Maurice is using data on Uber, and Uber has very different entry requirements. The Uber drivers have very, very different entry requirements in UK and Ireland. UK is much more linear. London is in particular, whereas Dublin in Ireland, they are much more strict. So we are comparing variations in the licensing regime between these two contexts. What is interesting, and that's something that I'd like perhaps to introduce in the debate, what is interesting with these case studies is that in some of them, for example, taxi drivers and tourist guides, we have been able to exploit new data sources that are becoming available. So, for example, in the case of tourist guides in Greece, one measure of quality we have been able to use is customer ratings on applications that you can hire tourist guides from, or on online platforms that allow you to hire tourist guides. And it kind of, I suppose, brings an insight into how we can use technology to improve our measurement of quality effects of licensing. As I said, I can't really talk about the results, but they will soon be released. Before I move to the UK, since Andrea is not here, perhaps I can talk about where things. If I have time, I won't be too long. About sort of where the European Union is. I'm not representing the European Union, but in terms of the thinking, the latest thinking, they see a lot of value, and I suppose it was touched earlier. They see a lot of value in behavioral economics and insights from behavioral economics when it comes to regulation. So I think quite popular at the moment within the European Commission corridors is what ideas from behavioral economics in terms of nudging we can use to guide practitioners to behave more responsibly, improve quality, etc. And this is something I touch in the driving instructor study for the European Commission. When I started doing this piece of work, we sort of followed a very traditional education economics approach in terms of judging quality based on how many new drivers pass their exams, and whether they pass it the first time, and so on and so forth. But when I was doing this work, I knew nothing about transport, and so I started sort of looking at the literature on transport, and it was very interesting to find that a lot of the accidents or a lot of accidents in terms of driving accidents actually do not correlate with the quality of the driving instructor. They actually find that they correlate more with the quality of the roads and the signs and the indicators that are used to guide drivers. And I think some of it is now picked up by behavioral economists in the whole idea of nudging I was talking about. And that led me to some work at EU level. And driving instructors is an occupation that is licensed very diversely, depending on which member state you look at. In some member states, your dad or mom can teach you how to drive, and that's perfectly acceptable. In other member states, you have to have driving tuition by a licensed driving instructor. And when you look at accidents and various other outcomes, you find very little variation depending on whether the occupation is licensed or not, or whether you receive tuition from a licensed or unlicensed driving instructor. So I think there is something interesting there in terms of alternative. There was a discussion earlier about alternative ways to regulate occupations or deregulate occupations. So I'm going to move now into the UK. A little bit of background. When we looked at what types of occupations are licensed in the UK, actually we don't find as many surprises as you do here in the US. So we don't regulate interior designers, we don't regulate barbers and hairdressers, etc. So these sort of very these outliers in terms of who is regulated are not there. There are only a handful that you look at and you think, why are we regulating? I mean, I'm going to talk about a couple later. But what is interesting from the UK perspective is that a lot of regulation actually comes from the state itself, and the state sees licensing as insurance. So the state feels more comfortable when an occupation is licensed because they feel that they are protecting the public, and they are protecting themselves against any litigation or any bad publicity coming from the public. We do not find as much intense lobbying as you do in the US from professional associations. But as I said, the state uses it as insurance. But I'm sure, as Shabbir will discuss later, the last few decades, the state has been more critical of this and sort of more reflective in terms of less willing to jump immediately into licensing. So we're seeing a bit of a more balanced approach lately. So going back to my graph, the growth in licensing between 1986 and 2012 is depicted there. So in 1986, for every so you can see the growth there. And my next slide is the one about unions. So back in 1986, for every one worker in a licensed occupation, there were about 6 union members. When you look at 2012, the figure narrows to 1.6. So clearly, licensing is going up and unionization is going down. So we regulate a lot of in the UK. We regulate a lot of professions and public sector occupations. There are some surprises, as I mentioned. So farriers. I don't know if you know, farriers feed horseshoes. There are about 200 of them. And I was actually part of a review. The European Commission about 5 years ago asked every single member state to justify the regulatory arrangements that are pertinent to the occupations in that specific country. So that meant that every member state had to go through, had to first of all identify which occupations are regulated, because a lot of member states did not know what occupations they were regulating. There was not a sort of a coherent list and database. Then these had to be justified. So I was part of the UK government sort of review, and farriers was one of the occupations that pointed out that, you know, we need to reconsider. And there are 200 of them, and the response was that for political reasons we cannot deregulate farriers. And I mean, my argument was, you know, they operate in small communities. Their reputation costs are quite sort of salient. there's a lot of word of mouth, you know, but yeah, so that was a very interesting one. And also what we have is we have a lot of inconsistencies. So art therapists are subject to licensing, play therapists are subject to certification, dance therapists are unregulated. Now these are occupations that are the skill requirements are very similar. Another one, like chiropractic and acupuncture, one is licensed, the other one is unregulated. So these are some inconsistent examples. But where the action is in the UK, as I said, in the UK, is more about this task demarcation between occupational groups. It's the turf wars that was discussed earlier. And quite prevalent these are within legal and medical groups. Very powerful doctors are not very keen on allowing nurses to prescribe certain drugs, for example. So this is where the action is. And this is where, if you go into specific case studies, you can see that actually licensing is quite restrictive in the case of the UK. Whereas if you look at a more sort of aggregate level, you don't see any sort of evident occupations that stand out that they shouldn't, you know, what is the rationale for licensing it? The wage effects, about 4.5% sensitive to the estimation sample, but within the same sort of levels we're finding in the EU. I'm finishing off. My latest work has been on job quality, so the licensing and job quality, and this was this is motivated by the sort of it's very the policy statements in the UK, government policy statements talk about more, but also better jobs. And also, you know, if you look at the ILO, job quality is kind of high up in the policy agenda. So we look at how licensing affects various indicators of job quality. So what we find is lower job insecurity associated with licensing, more opportunities for skill use and highest continued learning. But what is interesting is also we find licensing is associated with lower job autonomy and higher job demands. So from a job quality perspective, licensing is not advancing the quality of jobs. And I'm going to stop here because
So first, thank you for inviting me here to talk about this. It's an incredible honor. And second, I want to start talking about some of the research I did and plus some of the observation I had. Because as you see, I was born in China, academically trained in Canada, and now working in the US. Because my passion of occupational regulation, and then I start seeing a lot of things going on the ground. And this is something that I already did and something that I plan to do. So I'm very eager to hear your feedback and some interesting thoughts, especially from the policy side. So first, follow the path of what Maria discussed, that we are kind of like in the middle in terms of talking about Canada, right? Occupational licensing. In one sense, that we follow the same kind of Commonwealth definition that we don't have occupational licensing, even in our policy discussion. What we call here is occupation or regulated occupation. So we lump them together in terms of discussing occupational regulation. If you start looking at the federal list that presented to the workers, the regulated occupation in Canada actually combine both licensed occupation and certified occupation together. So in my five years of PhD study, the first thing I did is I go back to the legislature document and I start deciphering this whole definition and try to understand what is really going on, in terms of occupational licensing. So there are a couple things that I want to address here. So first is majority of the occupational licensing happen at the provincial level. Okay, we don't have much of federal regulation. We don't have much of municipality regulation. Everything almost like, if you look at the legislative part, they happen at the provincial level. Second, there are many kind of like, because of the decentralized nature here, and we see a lot of variations in terms of cross provinces. Right? Different provinces have different kind of like focus in terms how they want to license an occupation. If you go look at Quebec, like, ever since 30 years ago, they started license crazy in terms like how they want to regulate all the occupations. But other kind of provinces such as, Alberta or British Columbia, they follow up in terms this is going along with their economic development as well. And Ontario is kind of sitting in the middle. So we see a kind of like a weak correlation between the economic development and the progression of occupational regulation here. And I give you a little bit of example. This is something that I start constructing in my doctoral work. And if I go back to the legislative document, the language defining regulated occupation is incredibly inconsistent. Some talk about, right to practice, some talk about right to title. So this is how I kind of really separate these two groups of legislation, right? Like if you have anything that mentioned in the Occupational Regulation Act mentioning, you have only this type of person with license can practice, that's the licensed occupation. Otherwise, if you can only have this reserved title, but there's no restriction in terms of who can practice and how you can practice, then that's the certification. That's how I separate the Canadian definition. And hopefully, because the focus of my thesis work is to study the economic consequences of occupational regulation, that's why I start working on this part and really find something very interesting. So I want to show you, for example, the example that I have here, accountant. Like, we made a joke in Canada, especially in the field of industrial relations and, people interested in occupational regulation. Canada is like American in 10 years ago. Okay, so like here, if you talk about accountant, everyone knows that if you want to work as an accountant, you have to have a CPA, right? And if you look at the legislative document in Canada, the only language talking about right to practice actually happened last year. So that's in Ontario. Other legislative document, the Accountant Act, and they never mention that accountant needs an exclusive right to practice, except if you are working on auditing. So that's the only legislative language that we had there. But somehow it became a de facto profession that everyone recognized, I need something. And the funny thing in Canada is that up till, I think, around 2014 to 2016, we have 3 licensing bodies in accounting in each provinces. And they went through some interesting kind of aggregation. Now, every province has one licensing body, regulatory body in accounting. So that's the kind of a slow progression that we see there. And there's so many different occupations that you actually, if you go back to the legislative language, they don't require any license. But somehow, when we talk about a regulated occupation, they all considered regulated. And of course, you're all familiar with this. Morris already mentioned this in his amazing 101 introduction. And this is what we see in Canada. So if we start looking at this trend, the union density is still kind of decrease a little bit, but so far we're doing okay at the 30% range. But our licensed occupation coverage is only about 10, I would say 12% at max. But we observe the same trend if we only look at the private sectors. Okay, so this is another kind of observational that we are for 10 years behind compared to US, right? We start seeing this kind of cross, the similar that you observed in the European Commission, unions, that we have decreased union density and increased license. So I just want to kind of briefly report my study there, that we kind of study the impact of occupational licensing in Canada. We observed the positive wage premium, similar as observed in the US, and it's still a weaker institutional protection in terms of workers' benefit, okay? And then if we start looking at the distributional differences, occupational licensing benefit high-wage workers more, okay, compared to the unionization, which benefited relatively lower-wage workers a little bit more. And I further looked into the mobility issue, especially focusing on young Canadian workers between age 21 and 34. I didn't find a lot of association in terms of the impact of occupational licensing. Like a line of work in the US mentioned the decreasing the negative association between the occupational licensing and the interstate mobility. But if I look at the individual level, seems not so much. And comparably, unionization seems to, restrict worker more. So the kind of like an underlying mechanism that I identified is that maybe job security is a big factor, right? It's strongly associated with unionization, but less associated with occupational licensing. And I think this also kind of echoes Maria's study that, occupational licensing is negatively connected to job security as well. And so the main kind of policy consideration currently happening in Canada, maybe not currently, but in the past 10 years, we have two different things happen and concurrently, let's see. So at the federal level, there's a Canadian internal trade agreement, and there's a designated chapter focusing on labor mobility. So as a federal government, because we don't have the clear kind of like office or any kind of government agency to look into this whole process. So what the Canadian government did is that let's put all the provincial kind of government officials sitting in the same room. Let's negotiate. How can we facilitate the mutual recognition, make sure that everyone is on board, which occupation needs to be kind of mutually agreed, recognized across all the provinces, which cannot. So it's a kind of like a multi-ladder, multi-party negotiation process. And some of them actually worked, but others still, you see there's a list of exempt occupations on the federal government website that you can actually check and verify which negotiations are ongoing and which negotiations is actually not working in this process. And at the provincial level, I think there's agreement across different provinces that we need to have a more consistent approach. First, across different provinces, also across different occupations within the province. And one of the, approaches that across, I want to kind of use Ontario as an example because, I live in Ontario for a while and studied there. And first, Ontario decided to really streamline the structure of regulatory bodies. So now, all the government legislated regulated occupations have a regulatory body that recognized as college. So they no longer call themselves professional association. They have, for example, the physicians college or teachers college. They stand out as a separate kind of government representative. And we even have a college of trade now overseeing all the regulations and certification process of the trade. And the second part is that they start giving those colleges a lot of regulatory powers. So how you design your regulation, certification or examination process, how you design the trainings, program, a lot of things that kind of laid down to the college level. But on the other side, because the government recognized they don't have all the kind of expertise to look into those issues. So what they did is that they said, our purpose is to protect public interest in this whole system, right? So they're gonna require the regulatory bodies to have representatives from the public. And what we saw, one example is that, not healthcare. I want to talk about the HR professionals. The HR professionals in Ontario currently just getting their regulatory recognition from the provincial government. And the government said, okay, you guys become a regulatory body, that's good, but now you need to change the structure and the composition of your board members. So they added 3 board members, one from another regulatory college, which is, I believe, the Early Child Care Educator Association or college. And then the other 2 are having heavy a legal background. So now every time they have the board discussion, and then they're always kind of like a gatekeeper over there saying that, what about the public interest? This has become a part of the kind of a discussion ongoing in their boardroom about everything that they want to change in terms of how we manage our regulatory body, how we, require certain, regulated requirement. We want to change the recognition system, everything that has a discussion that happened at the executive level, how we want to change things. Okay, so that's pretty much the kind of policy changes and development happened there. But I think what unique about Canada is that in some cases that the government is the problem itself. Okay, so give you this example. In Ontario, currently we have 41 regulatory colleges. 26 out of it are in the healthcare system. Okay, and the reason I said that government is a problem is back to many, many years ago. Midwives are not regulated, and there are only a few midwives, actually practice. But the government kind of stepped in saying that we want you guys to regulate yourself. Because, you regulate yourself, you become a regulated occupation, and you can be incorporated into our, public health copay system. And that actually provided a cheaper alternative than OB-GYNs in our system, because, we have a public health care system, and the government tried to get a, cheaper alternative. That's one of the reasons that, a lot of healthcare occupations now become regulated. One side is that, they are lobbying, we have practitioners lobbying for the regulated positions. The other side is that government actually encourages them to work on this. Okay, so another thought that I want to have here is that because in the first session, we were talking about, the market, we want to have a minimum, government intervention and not restrict market entry. But I think the discussion also happened, when you have employers, when you have organizations, they sometimes act as a gatekeeper in this whole system, right? Give you an example. If you recall the early slides, that dietitians are only regulated or licensed in 2 provinces in Canada. But every dietitian practice within hospital are currently holding a dietitian certificate or license. So the hospital makes the dietitian become a de facto occupational, licensed occupation. So in this case, it really depends on how the market or how your employers perceive this whole legitimacy of occupational licensing. So we need to bring in some of the shareholders in this whole discussion. And we had this similar discussion with the HR professionals, and the regulatory body said, we understand our obligation to regulate and the whole profession to make sure our our members up to the standard. But the business, they are not gonna, hire you a HR professional just because you have a HR professional license, right? Because they have other alternatives. It's less of a restriction in terms of giving the regulatory powers to the professional association. So I think that's something that very interesting, and I plan to kind of continue to study on that part. Now I'm gonna pivot a little bit into the situation in China. So I spent quite some time in China talking to the academics there, talking to some practitioners, and talking to some kind of government officials as well, So I think there are 4 things I want to talk about here. Like they are kind of ongoing research agenda of mine. So I don't have much of slides in terms of like, present some result. But there are 4 interesting things that I want to share here with you guys, and hopefully I can pick up some brands that how we can have a more broader discussion to this topic. The first one is in China, there's no self-regulation because they're a political system. So all the, like, I'm not going to go into the legislative part, but in terms of managing the entrance exam, it was managed at the national level. Okay, so the kind of like, upfront agency is the Department of, they call the Ministry of Human Resources and Social Security. And that's the equivalency of Department of Labor here. And currently they manage 38 different national recognition exams for occupations. And it's still a decentralized system if we start looking into the process, because let's use the US term. The Department of Labor, they manage many kind of entrance exam, but not all the occupational entrance exam is regulated and managed by the Department of Labor. For example, the bar exam is organized, at the justice. And then, of course, pharmacy, funny enough, they were managed by the FDA in some states. And the second part I want to talk about is the unique challenge that Chinese is facing right now, because they need to reconcile some of their national license and the foreign license. This is especially prominent in the accounting side, because if you want to go to IPO, you need to have either a UK accountant license or a CPA from the US. So that's the challenge that currently some of the decision makers are facing. The last part I want to talk about Chinese situation is that they are working on tightening the licensing entrance requirement as well. For example, start from this year, the bar exam requires you have a law degree to take, and which never happened in the past. And accounting is going to the same route. And even pharmacists, and especially the commercial drugstore pharmacists, and there's a lot of discussion about whether people need a bachelor degree or not to take the pharmacist entrance license exam. So a lot of things happen on the ground about how we tightening the licensing situations.
Thank you, Tingting. Shabbir?
I thought I'd share just a few thoughts from a kind of UK government perspective and what we're thinking of at the Treasury. As Morris mentioned in his introduction, I work as the economic advisor to the Chief Secretary to the Treasury. And occupational licensing has been a theme that she's been very interested in over the past few months in particular, and something we're keen on exploring further. I guess just a bit of kind of scene setting from a UK perspective. Flexible labour markets have been a key strength of the UK economy over the past few decades. And you only need to see our response to the financial crisis to kind of see that. I mean, the labour market figures that came out earlier this week had unemployment in the UK down at 4%, which is the lowest since 1975. Employment levels at their kind of record highest. And I think we've had 3 million more new jobs since 2010. So in general, it's been pretty much a success story. But one of the challenges that we faced, and some of the, a key issue that we're thinking about the Treasury has been more on labour mobility and how that kind of fits in with wider social mobility. So some research showed that in the UK, the proportion of people moving jobs and region since 2001 has fallen by 25%, which is obviously a problem when you consider flexible labour markets, as I mentioned, has been a key strength and continues to do so. And I guess you can kind of split that into two perspectives. One is the more regional aspects, for which is a variety of causes, things like house prices being one. And two, it's also the reason as to why people are changing jobs less, why people are moving into different professions less, and what the wider social mobility aspects of that are. And that's something which kind of links in quite nicely to occupational licensing and kind of piqued our interest to start off with. It's worth pointing out that occupational licensing is obviously nothing new in the UK. There's a great example from the time of Adam Smith, actually, of the famous British inventor James Watt, who was barred from kind of practicing in Glasgow, a city in Scotland, based on the fact that he encountered his apprenticeship 25 miles away in a different town. But due to kind of mutual recognition standards, they didn't recognize his qualification in Glasgow, and he was kind of pushed out to work elsewhere. And considering he was one of the fathers of the Industrial Revolution and everything that's happened since, it kind of puts things into perspective in terms of, what are we actually doing when we kind of regulate some of these professions. In terms of kind of where we are today, so as kind of Maria's research showed, the UK kind of ranks, I guess, pretty much in the middle in terms of from a European Union perspective. So 19% of our labour force is licensed, and we have another 20% which is certified or accredited by different formats. But one of the things I found personally surprising when I saw that data is if you compare us to other European countries such as France or Belgium or Italy, for example, they have lower proportions of their workforce which are licensed or certified, which I guess naturally when you think about the UK labour market compared to the French labour market, for example, is not something that you would initially think of. And you would naturally have thought the UK would kind of rank much lower in that regard. But we've been thinking about, I guess, three key questions at the Treasury with regards to occupational regulation and kind of what our policy response to it should be. The first of which relates to something that was touched on quite heavily in the first session, which is the stock of occupational regulation that's built up over time. So in the UK, there were 43 professions that changed their regulatory status between 2001 and 2010. And one of the questions we've had is that, as was described earlier on, there's been professions that have perhaps come in at a registration stage, which have then turned into accreditation, which perhaps has then turned into licensing. And have we factored in the relevant costs and benefits at each stage of that process? Or have we almost kind of sleepwalked into a stage where by today we have occupations which perhaps are being regulated to more onerous standards than they need to? And that's a question. I mean, that's not, we don't know the answer to that, but that's just a question as to whether we have the right stock and the right mix. The second question related more to the costs, and specifically the costs that it has on consumers. So a lot of the research obviously focused on the employment consequences and wages in terms of licensing in particular. But an important factor, I guess a second order factor, is what that means for then consumer prices and what are the effects that has on the wider economy at large. So childcare, for example, was mentioned in one of the earlier sessions. And, is licensing leading to a state whereby we have higher childcare costs and then thus leading to kind of further labour market consequences down the line of people who can't afford to get back into the labour market? And it's things like that we want to consider further and make sure we have all the costs kind of fully thought out. And the last question is more to do with technology and how things have changed. So things like review sites have been mentioned already, but one of the questions we had at the Treasury was whether the licensing regimes that we have today are still as applicable as when they were first introduced, perhaps kind of 30, 40 years ago for certain professions. And that's not clear that that's still the case. So, we've talked about things like Uber for taxi drivers, and the review systems that are in place today suggest that some of the asymmetry of information costs that perhaps is the reason why we had some of this regulation in the first place isn't necessarily as applicable as it once was. And again, is the question to determine how do we engage with the technology, how do we engage with how people react to services today and feed that into our decision-making process. And these thoughts kind of culminated with a speech the Chief Secretary gave back in June a few months ago at the London School of Economics, where she announced the government's intention to explore potential review into occupational regulation. And the scope of this is very much still to be determined, and we're still thinking about how exactly we go about the review and kind of what professions we want to look at. And it's something I'm keen to get people's thoughts on over the upcoming days. But it is something, I guess, that the UK government is considerate of, and it's something that we're aware that is a major part of our labour market, and so naturally we need to be examining it in sufficient detail. The last thing, a couple of things I just wanted to add as a kind of aside, where one was related more to Brexit, which from a UK perspective we can't really get away from today. One thing that's worked particularly well over the EU over the past few years has been the kind of mutual recognition for professional qualifications. And in the UK, I think the figures up to 2017 were, since about 1997, we've had about 143,000 people moving to the UK from the EU whose professional qualifications we've recognised under this system. And it's been a real boon to labour mobility. In the European Council meeting back in March, our colleagues in Europe announced that they would like to have ambitious provisions, was the term they used, in terms of our future relationship post-Brexit, for professional qualifications and kind of keeping that mutual recognition there. And the Prime Minister set out in her Brexit white paper a few months ago that this is a position that we agree with. And I think there's definitely scope for collaboration, and obviously the final deal is to be announced, but it's something that there is definitely overlap and shared common interest in. The other slightly tangential thing I just wanted to touch upon was more related to policymaking and research in general. So on occupational licensing, for example, the Chief Secretary hosted a roundtable with some academics a few months ago, which Maria was a part of as well, which was really beneficial to us to kind of understand what the key issues facing the UK economy are, what the latest research is saying, and how that should affect our policy response. And it's something I think we need to do more of. So, engagements like this are obviously hugely beneficial to get policymakers and researchers in the same room. But I think there's definitely more we can do, perhaps on a more kind of informal or ad hoc basis, to ensure that the relevant insights from research and academics at large are fed into policy responses. And actually vice versa as well, and the questions that we're asking as policymakers and the issues that we're interested in, if that can be reflected into future research topics, it's advantageous for both. And I think that's something that, on both sides we can probably do more of. But that's just what I wanted to say from a UK perspective.
Great. Thanks, Shabbir. In a moment, I'm going to start taking questions from the audience, but let me start off by abusing my position of authority to ask a couple of questions myself. They're both for the entire panel if you choose to want to answer, but the first one's kind of directed to Tingting because I know she's worked on this. And that is, in your studies of Canada, which, like the US, has traditionally been as a very high immigration country, and obviously we know the UK and parts of Europe have been too, increasingly so recently. What evidence do we have on the role of licensing restrictions as creating barriers for immigrants integrating into the economy and into society? And then second, and somewhat relatedly, it's kind of come up, I think, a little bit in Shabbir's talk that a lot of what occupational licensing does today is in some sense related to a tradition of apprenticeship and craft unions that countries have had, and the UK certainly had that tradition. And an argument that's sometimes made is that occupational licensing, at least through some formal accreditation process, is like somehow a more democratic procedure. It opens up occupations to people who might have otherwise historically not have had an opportunity. So to what extent do we see some benefit from occupational licensing and regulation along those lines? So those are my questions, and I'll take other questions from other people over time. Do you want to go first, Tingting?
Okay. So, because I'm an immigrant myself, I'm super into this whole line of discussion about the economic consequence and the impact of market restrictions on immigration as well. So, we actually did a study a couple of years ago looking into the impact of occupational licensing on skilled immigrants. And what we find is as you guys anticipated, immigrants are less likely to work in licensed occupation in Canada. But once they get into those occupations, the licensing standard actually provided a remedy for them to have a higher wage premium compared to the native workers. And so that was in 2015, I think. And currently I'm having a couple more new kind of study using the tax data we just got for Canada, yay! Still, there's a kind of a barrier even after, the government recognized the kind of a negative impact of occupational licensing on immigrants, especially the assimilation. So there are a couple kind of a policy implementation there happened before I examined the tax data. They actually require all the professional association to provide alternative paths for immigrants to go through a much easier recognition process than they are needed in the past. So after that, and so far the kind of like I said, I can't really present as some kind of a definitive result at this point, but what I find in the preliminary result is that in the most recent years, and we did see some improvement in terms of, addressing the negative impact of occupational licensing on the assimilation process. So the barrier is lowering in recent years. And also somehow, this is interesting in my opinion, is that the immigrants who pass through the occupational licensing recognition process, they actually have a higher mobility cross provinces in Canada. So that's what I can talk about at this point.
In terms of migration, your question about migration, our work on, actually, that paper will be in the Atlanta session. So those of you that are coming to Atlanta in January, we've done some work on looking at how licensing affects the labor market integration of migrants and the wages of migrants. And the findings are in line of what you described, more positive outcomes when migrants go to licensed occupations compared to unregulated occupations. And I think when you talked about the benefits to certain groups, Peter Blair is here, and his work has looked at licensing and blacks. And again, I mean, you can talk about your work better than me, but there are positive outcomes for ethnic minorities when the occupation is licensed in terms of the labor market prospects. What is interesting, what is interestingly is happening, so this is where the research is. From a policy-making point of view, what has been happening is that governments, I mentioned earlier, governments are using licensing as an insurance for information asymmetries and public protection. But more recently, the UK government has been using licensing to upgrade the professional image of occupations and attract migrants. So supply into the occupation has been very low. And one solution the government has come up with is to license the occupation to upgrade the collective image of the occupation and therefore attract more migrants from the EU, but from other countries. And I've had some discussions with the Department of Health. They're actually entertaining the idea to introduce licensing to nursing assistants in order to enhance recruitment and address supply shortages, which is it's a very interesting idea, but completely misses the point of the costs of licensing. So yeah, this is.
Yeah, if I can just touch on the second question slightly in terms of social mobility and kind of getting people into professions, and I think there's definitely benefits as well in terms of having a common regime whereby I guess the rules are pretty clear for everybody, and it's kind of less perhaps based on influence, etc., and perhaps more based on professional qualifications in terms of getting people into professions. But I think very much the devil's in the detail with these kind of things in terms of you can also get to a stage whereby if the regulations and the requirements are too onerous, you lead to a position whereby if people are trying to switch professions or change industries and are faced with 2 years going out to school to study for kind of exams to qualify to work there, or faced with inordinate costs to meet training regimes or initial subscriptions, you're almost kind of limiting the amount of people that could actually switch and work in that profession. And that is a danger as well, to have segments of the population who perhaps feel trapped within certain industries or feel like they couldn't move to where they perhaps would be better suited for the economy, simply based on that initial liquidity constraint, be that time or money. So I think you're right. I think there are benefits, but I think the costs as well, and it's just about making sure we get the right balance between the two.
Great. We have a little bit of time for questions. I see Darwin has her hand up first.
Very much for an interesting talk. But I wanted to. Please. Always with the mic. So I wanted to thank the panel, but also when you are thinking about the growth of licensing, this sort of touches or ties together things from all three of your talks. Tingting, you mentioned in Canada the growth of licensing sort of did a jump at about 30 years ago, which sort of fits into a similar time period with the United States. And so I was curious if you have thoughts on what generated that growth, or when we're thinking about the UK, the degree to which this is just maybe a substitution of categories that's part of a much longer trend, that we're just trying to recategorize and put people into different buckets, but it's still some sort of underlying issue in how labor markets are being organized.
We'll take a couple more before giving the panel a chance to respond.
Hi, Dan Gilman. I work at the Federal Trade Commission here. We have so governments often are big and complex beasts. We interact with other U.S. government agencies in diverse ways for enforcement purposes, research purposes, policy purposes. Some formal, some informal, some more systematic, some less. We also interact with foreign government bodies, so Canada and the UK in particular, but chiefly I think with competition authorities in Canada and the UK. And so I'd be interested to hear both about your intergovernmental policy roles and relations with, say, competition and other pertinent authorities there, but also maybe to the extent that you have ideas about linkages, say, with what we do or across the usual channels, labor, competition, perhaps how those are or might be pursued.
I'll take one more. I think the man behind Darwin had his hand up.
Hello, I am David Rostam-Afshar from University of Hohenheim in Germany, and Germany was always on the top of the list. So when thinking about the question why there are differences in different countries in terms of licensing, there come three reasons into mind. One is the political economy that is different in maybe the UK and Germany. Second is the assessment of risk and the measurement of risk. Maybe risk is measured in a different way in different countries. And third is differences in preferences. So some countries might be more risk averse or value more heterogeneity in quality, while others don't. So I think one reason why Germany is on the top is clearly the history, because most of the licensing policies were implemented in 1935 to protect the middle class in Germany. So my question is, what do you think should researchers look at, and also what can policymakers influence? Preference heterogeneity is hard to influence for policymakers. It's easier to come up with a unified measure of risk or look at the political economy maybe. So is the political economy the most interesting topic right now to look at?
So let me give the panelists each a minute to respond. Shabbir, do you want to go first?
Yeah. If I perhaps kind of touch on the second and third questions. The second question in terms of international, I guess, cooperation and best practice sharing. I think it's something we do quite well on, though I think there's definitely room for improvement. So I'd probably kind of split that in terms of competition authorities and regulatory bodies in the UK are kind of very good at liaising with their counterparts, especially in the US and the European Union. And especially, if you look at the financial markets, for example, and regulations since the crisis, there's been a lot of international developments in terms of working together to appraise policy responses. Where I think we can perhaps do better is sometimes on the policy-making side. So, thinking about occupational licensing, for example, my personal view is that it seems to be more of a pertinent issue in the US than it is in the UK. But in terms of, I guess just simply comparing notes and seeing what policy responses are here and what things have worked and what kind of measures we use to appraise benefits and costs, I'm not sure that linkage always exists between government departments. And touching on kind of what you mentioned just now in terms of appraising costs and then kind of what risks are, there is definitely room for having more international cooperation in that regard. And just one point as well on what we can do and what we should be focusing on, both from a kind of policy making and research perspective. I think one of the things we should be looking at more detail is kind of specific jobs and sectors. So a lot of the research in the UK, and I think one of the problems we have in the UK is simply the data isn't that great and it isn't necessarily available, nor is it there in the first place to kind of share. But the effect that has is that we often have sort of, I guess, more general sweeping comments of what the effect of licensing is on employment or is on wages or prices, etc., at large, rather than necessarily having the data to appraise things by profession. And I think it's important to make sure that we look at things on an individual basis rather than kind of generally characteristic things as a problem for the economy. And that's something I think we should work with kind of researchers in more detail in terms of, what data perhaps could we collect as a government or what data could we help share as a government to help promote some of that research.
Tingting?
So I want to address a little bit on Darwin's question first. So yes, there is kind of like a re-label people around, because around that time, like we did license teachers and we licensed many occupations in healthcare system. And we also bring in those new kind of like advanced, not really advanced, but like technical advanced occupations such as professional engineer. So you see a big jump at that time is that because we got a lot of new occupations being licensed. But different from the UK, in the most recent 5-10 years, like, you rarely see occupational regulation has been introduced in the Canadian system. Yeah, so the policymakers are aware of this issue. And the second question about intergovernmental authority discussion, yes, there is something, like one example, for example, like, Ontario government recently tried to introduce the prescription rights to the nurses. And there's a huge fight between, whether we allow our nurses to practice independently, different from, family doctors. So like, colleges are fighting between each other. And then the government is has been very laid back in this process. So we still haven't thought of like, how nurses can use their prescription rights. But what we saw is that many clinics now, instead of seeing, family doctors, the patients are seeing, nurse practitioners and then, doing those kind of like regular checks. So it's happening at the bottom with practitioners that work together.
Maria, do you want to try and explain Germany for us?
I think I'm not sure. I think Germany is an outlier in the sense that it's the most and correct me if I'm wrong, is the member state that seems to be more resistant, Germany and Austria, in the more sort of deregulatory initiatives that were part of the European Commission's agenda, and now they're filtering down into member states. So, we see Poland recently deregulated 360 occupations. Due to Troika restrictions, this was also the case with a lot of Mediterranean economies, Cyprus, Greece, Portugal, Italy, etc. Romania, Hungary, they have embarked on deregulatory policies as part of more general labor market deregulation. So Germany seems to be the most resistant one. And as you would agree, when we go to the European Union and we talk about research, it's usually the Germans and the crafts that it's more likely to oppose. So political economy, I suppose, stands out as the most sort of obvious explanation, and I would agree with that. But the more I look at specific occupations and the history behind the regulation in different member states, I think there is preferences are very important, and also and the government state preferences I think are interesting explanations and very plausible explanations as well. As I said, I gave the example earlier. The UK government is keen to regulate, to upgrade the image of the occupation. So there are a lot of different reasons why governments embark on licensing, but I do think Germany is a general outlier in the European Union. Yeah.
We have time for some short questions. Morris.
Yes, this is addressed to Tingting, although others might be able to answer it. I know that Quebec allowed anyone from France who has a license in France to come to Quebec and their license is immediately accepted, where that was not the case in the other provinces. That seems ripe for a very interesting and perhaps clear example of what might happen when deregulation occurs.
Anybody else with a short question? Back.
An unfair question. In your opinion, would the pros and cons of regulation apply to developing nations in the same way they do to so-called developed nations?
I was just wondering whether or not, in terms of looking at this whole space, we've got to differentiate between those professions that are encompassed by the General Systems Directive in Europe versus the others, because I think there are a whole series of levers that have been put in place, which although the process is transposition, but just joining the club, you've got to change all your legislation to align with what's already there. And I'm just wondering whether there's some ripe areas for research in differentiating those that have been part of that system versus the others.
So I think we have about 90 seconds for answers. Can you give us the short answers?
Okay, I'll go quickly on the last question. So yes, in our work, we've shown that automatic recognition brings better outcomes in terms of labor movement, which was basically the reason why this legislation is there. So this is seen as a very favorable mechanism to facilitate member state movement between member states. Absolutely, yes.
Mark, can I answer the last question, or one of the questions?
How about we let the panelists answer?
Okay.
And we can talk at lunch. Tingting?
So quick question about Quebec and France mutual recognition. It's more like a cultural or political consideration rather than economic consideration. Like the rest of Canadian province, they are more like, the Anglophone type. And Quebec is going the other route. That's why you see that the interprovincial difference that Quebec is off the chart in terms of occupations that are being licensed. And I also want to address the developing country question a little bit, even though I was referring to China. I want to give you a kind of a quick statistic in something. In 2014, there are 78,000 licensed pharmacists that can operate a drugstore. So the people you saw, at CVS. This is a country, and this people represent 17.27% of the people who actually running the drugstore in China in 2014. And this is a country that we're talking with 1.4 billion population, and you can actually buy antibiotics without drug prescription. So that really starts speaking the requirement. And 60% of those people who actually got licensed, they don't even have a bachelor degree. So they are high school or, lower degree. So that's the situation that we are seeing, that, when you have a really low quality practitioners, how you can protect public health. So that's the discussion that happened in many developing countries. Maybe we need to tighten the requirement of occupational licensing. But the problem is that if you tighten it, nobody wants to take the exam. Nobody wants to be licensed. We're going to get a lot of people that are working in the gray area. And then how can we protect the public health? That's a big discussion as well.
I'll give Shabbir the last sentence.
Nothing to add on those questions. Thank you.
Please join with me in thanking our panelists.